wanted to thank the authors. I know your heartfelt concerns and your knowledge on this issue. I also want to thank all the parents on both sides of the aisle of this thing, because it's all about our concern for our kids. So arguments can be made on both sides, and I'm not going to get into the science of it because we could debate it all day, and it's really not about whether vaccines are right or wrong. But one of the things that I noted is what makes mandatory vaccination such a hot topic is that unlike other medical issues where a sick or injured person is treated, with vaccines we're basically taking a healthy individual and then treating them medically in the absence of an illness. What I've seen with all the reading, the bottom line is despite originating in one of the most densely populated places in the country, the 2015 Disneyland measles outbreak was successfully contained and only affected 0.00035% of the state's population. There's no public health emergency and no need to eliminate informed consent protections in California public health laws. In fact, I would assume that with the Disneyland outbreak and all the media attention, actually vaccination rates probably went up in the publicity that came out of that. Now, I grew up a while ago in New York City, and there was a huge television and advertising campaign about Pica. And a lot of the moms here are young. They probably wouldn't remember that, but it was due to kids picking paint chips that had lead off the wall and eating it. And it was a big deal in New York City back in the day. And there was a lot of education on that. And then, that issue, we haven't heard about it. I mean, it's still out there, but it's not near what it was. And I think education and what happened with the Disneyland and that media attention can bring more people to say, gosh, maybe it's time I get updated on the vaccines. But the two things that really concern me with the bill, I feel we're creating a false sense of security for parents with immunocompromised children, because even with 100% vaccination rates, there will always be someone with an illness. For example, a parent who comes in to bring their kids lunch that they forgot for the third grader. A person with HIV or Hep B, it's not allowed to say that someone has that. It's a privacy issue. Those people can be in the school. A maintenance person, a landscape person working on the campus, a child who for some reason the vaccine hasn't worked, and so on and so on and so on. So I don't want to, believe that just because we don't 100% vaccinate that we're going to create this false sense of security in the school. But my biggest issue is the loss of freedom. In our Constitution, the individual is sovereign over the state. And I know that's come a long way, and we've forgotten about that. But informed consent is a human right. It's been stated that there's a responsibility in the freedom of choice, and therefore those choosing to limit vaccines face the consequence of not being able to send their child to school. So therefore they choose not to, then they have the responsibility, then they don't go to public school. This will hurt the underserved community more than anybody else. And according to the ACLU in their letter, education is a fundamental right under California Constitution. However, on the flip side, there's also a responsibility on the state when it mandates or forces medical treatment in order to attend school, and in other places we hear about getting a job or other things. To explain that, and it kind of goes in line with my questioning earlier, there's a reason there has historically been various exemptions to any mandatory vaccine law. Simply said, a parent must sign a consent form for treatment of their child to get a vaccine. The doctor won't sign the consent form, nor can they legally do so. This is because the parent or guardian is 100% responsible for the health and well-being of their child. If this was not so, the state would allow the treatment without the authorization of the parent. Therefore, it follows that the parent then is legally responsible for all liability or injury that might occur. If the state is going to coerce or force parents to vaccinate in order for their children to attend school, then the state should take on that liability of that mandate. So I will be voting no on this bill.